MSPI, DVPI, ACORNS grantees, we all have mandatory reporting pieces, whether it's a progress report or you are required to have strict data collection plans. And so just having simple systems to track your program strengths and weaknesses, they can help you in your current funding cycle, but they can also help you for future funding cycles. So we're hoping that by providing you this support, you can have a way of working with us to make sure that you have all of that great work you're doing captured via data. Additionally, we picked SurveyMonkey and Excel because they're particularly affordable and simple ways to create and analyze online surveys. So today, just an overview, we're going to go over first how to just create a simple survey, what collecting responses to the survey can look like, analysis of the data once you receive it, taking that data and exporting it from SurveyMonkey, bringing it to Excel, manipulating it within Excel, and then just some basic data analysis you can conduct within SurveyMonkey.
And Vicki, thank you for joining us as well.
Another big question, just wanted to get out of the way, was how much everything costs. So SurveyMonkey Basic is completely free. It doesn't have the some of the more advanced features that we'll be showing you today, but SurveyMonkey Pro is $300 annually for nonprofits, and typically you can write a line item for this cost into your grant budget. So we'd be happy to help you offline if this is something you'd be interested in learning more about how to do. So please take note that that is something you can do. So first and foremost, we're just going to go ahead and dive into the survey creation piece. We're talking first about how you plan your survey. So when it comes to planning your survey, it's all about asking those right questions that link your questions to the strategic learning objectives of your actual program. So I know each program, MSPI, DVPI, ACORNS, have pretty strict objectives, and so that's a great place to start when you're trying to find out what do I actually assess. Secondly, what are the people I'm assessing? So if you're looking at youth outcomes, for example, make sure that you're measuring the right population. And is not to be condescending because it seems very simple, but that can happen to any one of us where you accidentally are polling staff that maybe only work with adults about youth outcomes. And so your data will be skewed and not really accurate towards what's happening for youth. That's just one example. Thirdly, we talk about what you want to measure. A nice acronym for that is KBI, so knowledge, behavior, and impact. In terms of the grants that we're all working on, knowledge could look like something like referrals. Do providers know that they can provide referrals to behavioral health? And then behavior would look like, okay, once they have the knowledge that they do these referrals, are they actually conducting these referrals? And then third is impact. Once the referrals are actually delivered, are they followed through? And so that's the kind of question formation process that goes through our mind when we're working with.
Oh, go give her that. Go give her the ice cream, please. Yeah.
Hey guys, is everyone hearing us okay?
You can hear us at all?
I never started.
Saying shared, we haven't started. We have people on our attendees list.
But did you He cribbed.
Hey everyone, bear with us for a little bit here. We have some people who are having difficulty getting onto the webinar as well, so we're going to give them an opportunity to come on as well.
We're having fun on a conference call now. Everybody's getting cut off. Others are coming on.
What time are you leaving?
It looks like a snowman nose carrot.
Hi, sorry about that, everyone. We're running into some technical difficulty, but we're back. So we're going to continue this, and if anyone else joins, they'll join. We'll have it recorded. So this is actively recording. If any of you have missed a part and want to go back to, we can definitely talk about that, or we'll also have it available as a recording. So as it stands now, everyone, Vicky, Lucretia, Eileen, Donna, Kathy, Arlene, can you guys hear us okay? Is everything, can you see the screen as well that we're presenting?
Yes, everything's going good, Arlene.
Okay, thank you. So let's just continue. We'll have the recording available for everyone else.
Great. Well, thank you, Arlene, for that confirmation. We'll just continue. So I just kind of left off at the KBI. So that's a nice little acronym when you're trying to actually plan out your survey. And another point, when you're planning the survey, this is the time when you have the notepad or you have your Word document open. It's not really, you're not going to worry so much about how it's going to look. It's really just almost like drafting a paper or writing an outline. And thirdly, I wanted just to talk briefly about control groups and the whole concept of filtering. So if you're trying to get a big before and after, especially these 5-year grants, control groups are important to think about if you want to get actually accurate data from like year 1 to year 5. If you are measuring information from an entirely different group by year 5, that's probably not going to be the most accurate. So there are ways within both SurveyMonkey and Excel to make sure that you're measuring information from the same groups to make sure that the outcomes are accurate. Next up, I'm just briefly going to discuss how you design your survey. So when you're in SurveyMonkey, there's just several different question types to use, and I just have in this right corner of this slide, you can see there's multiple choice where it's strictly only one answer. There's multiple choice where you can have multiple answers, like a box, you could check many things. So if you're saying how many times a week do you exercise, that's probably one of the answers where you want it to be anchored, so you could only have one answer. So it'd be like 1 to 2 times, 3 to 4 times. But say if you wanted to know what types of exercise do you engage in, you'd probably want to have it multiple choice boxes where anyone could check anything. So it could be walking, lifting weights, and that's an example of how you would use different types of questions. And again, this is just a very surface level introduction to ways you can do this. But I wanted just to let you know that there's various ways to approach question types. And the best practice in question design is just making sure that you are limiting open-ended questions. So if you have a question that you know is only going to be 1 or 2 words, there's ways to actually make that happen within SurveyMonkey. So that's a feature. Another one would be multiple choices should be mutually exclusive, so don't be too confusing. So if you're saying, are you, don't make 2 responses overlap, basically. Try to keep them very mutually exclusive. Within SurveyMonkey, and I can show you this at the end, more tailored to your actual project, is the ability to go to question banks. So they actually have really, really deep delves of different types of questions that have already been asked. They keep track of all the different surveys used over the previous years and different templates. So say you want to create a survey about health, it's likely that there's a similar survey that's been created around what you're trying to look for. And so it's really cool in that you could start typing your question and it'll actually pop up with completing your question with maybe 30 different ways you could ask that same question. And again, I felt the need to tailor that towards the end based on your personal questions on what to do. And the last three things, you can copy questions and move them. So if something, you can write out all your questions and then feel free to read it, take it yourself, and be like, I don't really like that question number 1 being there. You can just drag and drop it down to question number 5. And layout and styling, again, there's so many great templates that can reflect the questions. If you're asking about community gardens, there's templates that look like a community garden. If you're asking questions about a more serious subject and you don't want, you can just keep it black and white. And then lastly, printing. So once you make these surveys, you can actually print them and hand them out, and they look very clean and professional. Next, I'm just going to gloss over the ways you could implement your survey. And so the main collection methods would be via a web link or hard copy, but there's lots of different ways. So a web link is nice, especially if you're doing 600 sites. Instead of having to hand out paper copies and manually enter them, you just send everyone the web link and they will fill it out and the data gets stored into the SurveyMonkey program. Also, SurveyMonkey allows you to email out your survey, so when they actually receive it, you can see, oh, this person took the survey, this person didn't take the survey, so you can actually target people for like a second email without feel like you're spamming people that already took it. And then there's Facebook. They give you a little Facebook link, so if you have a Facebook account for your clinic or program, or you can just have it on your clinic site and anyone can take it. And then hard copy or telephone. Obviously, if you don't have the technology, say you're at a GONA and you really don't think that everyone's going to be have any service to be taking them online, you can have hard copies or actually have people ask the questions and write it down and manually input that into SurveyMonkey. And then quickly, I just want to talk about the address book feature. What's really nice is once you use SurveyMonkey to distribute your survey, the address book will store the names of everyone you've ever reached out to, and you can actually use that throughout your entire 5-year period, which is really exciting, or whatever grant cycle you're in. And the survey invitations improve response rates because it has funny little phrases or different designs, and it just kind of looks different than a basic email. So it's fun to play with the way you can send survey invites. And then also confidentiality and anonymity. I know that's a big concern for a lot of people, especially health data. So there's a lot of ways to create settings within the SurveyMonkey program to make sure that you have no way of tracing. And that ties in with collector settings. There's a lot of restrictions around even knowing what site you collected the information from.
All right, so now let's talk about, before we get into that too much, I know many of you might have questions, but before we get too much into that, let's kind of go over Excel before we get into too many details regarding SurveyMonkey, because we can be on that all day. But let's just go over Excel as a database. I use Excel as a database sometimes, and I think it's a really neat way to examine data. You can do it similarly to how other database applications use it, which is to sort, filter, or reorganize the data. I mean, if you use Access or SPSS, it's similar in that way. Yeah, so it's just a really good tool to help you keep track of your data and find specific information when you need it. The way I like to think about it, if any of you ever go online car shopping, one of the things that you do is if you're trying to sort by make or model of a car, I only want to buy a Mazda. And then maybe you want to filter down the price range from whatever your budget is, maybe $8,000 to $12,000. And then you're only seeing the listing of vehicles that are your specificity. and then you can reorganize accordingly. That's the example I like to give. So that's kind of how you want your database set up, so you can find the information when you need it and how you need it. So let's go ahead and keep going here. So again, it works the best as a database when you enter the data properly. I can't stress that enough. So you want to make sure it's organized accordingly. And we'll go over that in a minute, but that's just one of the two best ways is to make sure it's entered properly and it's organized in a similar fashion. That way you can always sort and filter. You can add new records and you can format it the way you see fit. But it needs to be consistent, and we'll go over that a little bit more too, how to ensure it's consistent at all times. And then this portion is a little basic as well, and I understand many of you maybe know a lot of this stuff, so that's why we're going to do a quick review of that. So entering data, let's see, you can think of it as like data storage, I guess, is another way to look at it. You're going to see this layout, which many of you who work with Excel might think of it as like a list format. We'll just call it like a table layout, in which there are columns and rows which represent a specific item. So each row is kind of like how I like to think of it as like a survey. One survey entry or one record is the row. Since I often work with like health data or clinic data, one row to me is like patient. It's a patient per row. And then the column is the variable that's on the survey. And if you want to open up the survey that we have given you guys in the handouts, go ahead and look at that. We can see that over here you have age, for example. Clearly that would go in the database as a variable age. But the point is, each of these would be a column as you enter the data. So you see here one row, that would be like the patient or the participant who took your survey, and these are your questions you ask. Very, very simple, I know, but it's a really good way to ensure that when it's all said and done, you're done collecting your data. It's really a good way to capture the quality so you don't have to go back and reconfigure later. One tip I will say is just try not to have any blank rows in Excel. It doesn't like it. Blank cells are fine, like individual cells. I typically even, like if you look at the screenshot, I do not available, or I'll remind myself that those are missing, but they are fine. Blank cells are fine. Just the blank as a whole row. For some reason, Excel doesn't like that, especially if you start like sorting and filtering, and we'll go over some of those examples. So I wanted to put on here, many of you don't need to know this or do this, but I like to kind of remind myself that when I'm entering data, especially if I get like 100 surveys and I've already created participant IDs for the survey, and then depends on how you set it up. So for example, let's say you collect 30 surveys and you want to start entering your data. One good way to start doing that is come up with your patient or your IDs that are going to both be on the survey and in your database. Just a little quick method or tip, I guess. If you look at the screen, I have our survey open. So this column is the participant ID, and I have given this to you as well. So there's 104 participants, and a good way to kind of do this, if you don't want to just keep entering it over and over, all you have to do is enter the first two, and then from there on you just highlight bottom arrow or bottom cross, click it, and you just drag the rest of them. That way ensures you're entering it in the proper order, if you collected them in that order, that is. So, all right, let's keep going. Again, quickly, when you're organizing the data, like I mentioned before, the row is considered like a record. When you keep that in mind, it becomes much more simple. Again, no blank rows. Each row contains the specific item, a specific survey, a specific participant, or whatever you're trying to capture in your survey. I'm sure many of you are trying to capture health-related information or things that are health-related. So that's why I figured these examples would be most useful to you all. And just a quick screenshot of how that would look, like what I just went over. Again, this is only a cross-section of the survey. You can actually see this on the actual survey in the handouts, but whoops, let's go back. The participant ID would be in the participant ID column here, and then the age of the participant would be here. So in this example, the participant was 18 to 29, and then so we entered it accordingly. And in this screenshot, of course, we didn't see the whole database, but most of them in this section are 18 to 29. They said in the survey no as a tribal affiliation, so we'd enter it as no. Now you could leave that blank, but I try to get in the habit of writing something like no, not available. But the main point I'm trying to get across is when you enter in Excel, you want to just make sure it's the same fashion. So if you're entering 18 to 29 as the age group, you want to enter the next person who's 18 to 29 as 18 to 29 years. I mean, that can get a little messy in Excel. Just, consistency is key. So again, some final words on organizing the data. Again, the columns are fields. The column heading, it's important because that is kind of going to be what your variable names are going to be. Sometimes you might know it as like a field name or a header row. That just ensures that the data is entered in a similar manner. So you're always going to be entering, for example, age of the participant for that one participant, or the gender of that one participant, the tribal affiliation, and et cetera, et cetera. So it's a good way to be the only row that's different. Again, many of you probably know that. Again, here's an example. The header row is the only different one. Everything thereafter is going to be similar. So it's either going to be male or female. I was going to be whatever they identify as tribally. Column heading, again, it should be formatted differently. It can and should be formatted differently just so you can see it along the way. And I like to do italicized font just so I know that's the header row. Again, consistency is key with that. And so that basically are those small rules before creating the database, making sure the rows and columns are formatted properly. Then you can begin managing the database, and then you can start doing the filtering or the sorting to kind of start getting those insights into your data. So we're going to go over a quick example really quick of how to make that filter row in Excel. So just go ahead and highlight that first column. That's your header row. Go to data and then filter. That's literally it. And I'll just quickly go over that example on the right here. So this is the same one everyone else has. So if you just go ahead and highlight it, go up here to data, filter. So now the only difference is that you can begin filtering this in whichever way you want. Like we talked about the car example. In this example, if say we only want to look at those in our data set who are 45 to 59 or 45 to 59 and 16 older, we'd press OK. Now it's only showing us a smaller subset of the data, and then among those who are tribally affiliated, because they had the option to press yes or no, and they said many of them said no, and many of them said yes. So let's just look at the yes, and our data set gets smaller and smaller as we start filtering out of this. And a good point to think about when you're doing this is a good way to describe our data set, or just describe the sample that we collected. When you're sorting and filtering, it's in no way a way to make inferences on the population you collected from. So if you collected from the tribal population in Northern California, say, this is in no way saying those who are 45 to 59 and 16 older are more likely to have a graduate degree, as stated down here. It's not intended to start making inferences or generalizations, but it's a good way to describe what you're seeing in your data set. If that makes sense. All right. So, and again, I just went over, I left a screenshot here in case some of you forgot my process, but yeah, just go ahead and click on that to start filtering. So now that you've created the database, you can use those Excel tools and start getting those insights and get familiar with the data, what it says and what it doesn't say. It's a really simple way, but it's very effective. And just a reminder, if you want to come back to this, the sort function sorts any column in ascending or descending order, and then the filter applies a filter that you want. Again, we applied the filter of tribal affiliation, yes. So we were only looking at those who said yes, or we applied the age group filter. Just a screenshot of that in case you want to remember. And then another screenshot of what we did. We applied the tribal affiliation, yes, and then we also applied a second filter of specifically among the data San Pasqual Band of Mission Indians. So then that gives us a smaller subset. So we're only looking at those who are not only tribal affiliated, but also San Pasqual Band and Mission Indians as well. So, and then to undo it all, just go ahead and click on the filter and unapply it and do the same for tribal, and then you have your whole data set again. So sometimes it's you want to know if you can go ahead and add new records or new rows. I just wanted to make a point real quick because I know sometimes we're creating these databases and managing our surveys and our data. It's perfectly fine once it comes in to go ahead and keep adding rows or records to it, because you want the most complete database as it is for that survey. So if surveys come in, yeah, of course you want to add to it all the time. It happens all the time. And then quickly, one of the last things I want to talk about with the Excel portion before Marissa takes over is just the formatting. Now, I typically don't format like my database too much, but you can use a column header as a different color, or you can even freeze the header row. So for scrolling purposes, not necessary though, but it comes in handy if you open up the Excel document that we have. I'll show you an example. So you just highlight it, and then you can freeze this first row. So when you're scrolling, you'll only ever see this first row. So let's see here. So filters on. Here it is, freeze panes, and then you want to go to freeze the top row. So now, if you see on my screen, I'll scroll down, and it'll always show me the header row. I can come here and change the color. I change it to green. You can bold it. It doesn't matter, but some people like to know that option exists. And here's a screenshot of that in case.
Yeah, so it was nice. It was good to have Michael come in and show you the Excel features, because they really mirror the features that SurveyMonkey provide, and it's nice to know that you can work with both programs and get very similar results. But here I just wanted to show you first about inputting survey data into SurveyMonkey. So we provided within the materials an example of a generic health survey that we created. And so if you were to give this out as a paper survey, you could definitely just have everyone fill it out, and like Michael discussed about the unique identifier, put your own identifier on it. And then when you're in the SurveyMonkey program, you can actually choose add data manually right here. Once you're at this, so you would be at the place where you're collecting responses, and you actually take that survey and put all of the information into SurveyMonkey, and that makes it nice for you to break it down. You can export it as an Excel doc and then manipulate it just the way that Michael showed you within Excel. I also wanted to kind of show you how you can get the same results from distributing a web link of the very same survey. So you would actually go in, create the survey into SurveyMonkey, and then share a web link with the people on your email list, and see how here there's different types of web links, so you could actually track. So say clinic 1 gets this web link, you can see how many people from this clinic fulfilled the web link. Or if clinic 2 wanted, if you can just see, oh, 0 people from clinic 2 was able to fill my web link out, maybe I need to mail them some paper surveys. So that's a great way to kind of analyze how you're collecting your data. I also wanted to show you some features that SurveyMonkey offers when you're trying to take the results from your survey and analyze them. So you can easily pull summaries of your results. There's ways to share your results live. I saw one person use it for fundraising, and they had it linked to a website that showed every time people were donating, and it was linked to SurveyMonkey, and it kept it like a live stream online. Or once you have your final data, you can create really nifty reports, really fun graphs, bar graphs. And then you can, like I expressed earlier, download those results into formats from Excel to PDFs, very polished looking reports. Also, You can make custom charts. So just like in Excel, when you can filter via which tribe you're trying to look at or which age range, similar features. Browsing individual responses, say you really only want to know responses from clinic A, there's a way to filter through that. When you get qualitative responses, I know sometimes qualitative responses can be hard to break down, so you can actually select basic phrases and it'll show you how many instances that phrase appears. Also, this is an example that Michael shared where you take the amount of words that were presented within the qualitative data and it is a word cloud, just a depiction of what was the most prevalent. And so it's a nice way to visualize what was communicated throughout the story. Let's see. So yeah, so we wanted to make sure that we had a good chunk of time for questions. I know we didn't get a good chance to look at the SurveyMonkey and actually open up the program and explore. So I thought this would be a good time for you to ask specific questions and we could show you how to do that. So I'll just go over a few of the examples. This was the generic health survey that we made. Let's see, where is it? We have all sorts of surveys in here. Let's see. Okay, so this is the exact same survey that we made. So this is the paper survey, and what I did is I took the paper survey and put it in to the SurveyMonkey interface, and there's that survey ID number, so I would have marked whatever number it was for the person who took it. I put in the age, tribal affiliation, and what's cool about when you're in SurveyMonkey, you can do skip logic. So for example, down here where we have the question, how many days per week do you consume alcoholic beverages? And then we have 0 days all the way to 6 through 7 days. Say we wanted to dig deeper. Say we wanted to know about the people that did 6 through 7 days. We could actually have a logic where it goes deeper. So it says of the people that consume alcoholic beverages 6 to 7 days, we could say, what are the conditions of your intake? Is it at a bar? Is it at a social gathering? And so if you feel like you want to dive in more, skip logic's a great way. And then if someone didn't select 6 to 7, they would automatically go over to the next. So that's a great way for you to be able to get even deeper without having to inundate unnecessary questions to people that it doesn't apply to. I also know for a lot of people on these grants, you're required to report out, especially if you have youth-oriented. I know age range is really huge. So when you're actually looking at results, just like Michael was showing you in Excel, you can look at respondents' answers. You can export them. So let's do question summary data. You could do it as a PDF, as a PowerPoint, as an Excel doc. So let's say you want to export it as an Excel doc, and say you also want to include open-ended responses. It'll let you open it up. There you go. And so you can use that, and then say you want to apply some of the filters that Michael discussed with you. You have it all put in there. You didn't have to manually enter it. So it takes out a big chunk of time that you typically spend entering data. Also, it has these nifty graphs. You can use them to share in PowerPoints.
Mm-hmm. And in SurveyMonkey 2, this one here is an individual response, but if you wanted something similar to what we were working with in the Excel document, you would want to export the entire database. So export all. You would go to export all response data. And this way, you're not just looking at what Marissa showed you was the individual response for age, which is good. You can get a graph of that, and you could put that into your reporting system or your grant or whatever you're doing. And then, so to export this, we'll do the same thing, and it'll download here on the side. It'll show you all the things you've been exporting, and it'll give you a little icon that's ready to download, and you can just go ahead and open it again. So it'll give you two files, a CSV file and the Excel file. It's up to you which one you want to really look into. Not working here for us. Can't open two workbooks at the same time. Close. So in this example data set, there are less entries, but this is everything, how it would look in hours. So to make it the same filter that I applied earlier in my Excel database, I would have to delete that second row, but then we can still do the same exact thing, data, filter. Now you have the filter. You can filter by age groups, tribal affiliation. If they said yes or no, you can still apply those same filters. So this is kind of a cool way to look at, like, if you're still familiar with Excel and you want, if you're starting to use SurveyMonkey, you can still, after everything's done and collected, you send out all your web links or you post on your Facebook and you got all your responses collected, you can still export to Excel if you're comfortable doing that more in Excel and still have it here. Or you can look at individual responses and get individual exports for that. And they have graphs that they suggest to use as well. Obviously on this one, it's a different bar graph than was exported to us. But you can look at those individual answers already without having to do any work. And you could do this, it'll show you it as you get your data. So when your data set gets bigger and bigger, or you get more responses, it'll show you your analysis along the way until you're done collecting. So incoming responses will affect these. To keep in mind. If you look at that, you can look at text analysis for the open-ended responses. Obviously, those are zip codes. It's not going to show us anything. Marital status, physical activities, same as the survey. It's the exact same questions, but this is looking at it on SurveyMonkey. This one gave us a text. So this one gave us that word cloud. Obviously, people said three things: green beans, corn, and carrots. Carrots, the biggest word. So that came up the largest on our screen. Again, with what type of fruits do you use, text analysis, banana. Apparently, that was only one. So that's kind of just some basic functions of this, and we wanted to make sure to tie it back to how it comes back to Excel, if you're comfortable with that, which is fine. Let's see here. So maybe for this remaining portion, if anyone has any questions, we can go into more discussions, review examples. If there's anything not covered that maybe you would like in another webinar, we can go ahead and discuss that, because the whole purpose of this webinar was based on feedback that we received, things that grantees from both our programs wanted to know more about, which is why many of you are probably thinking it might be very simple or foundational, but that's kind of what we wanted, so we're not skipping anyone that maybe wants to know this stuff. But we will do future webinars if you guys give us your input about things you want to cover in the future. But go ahead and let us know any discussions or things you want to have now.
And for one question, I just was wondering if anyone has like a specific outcome that they're currently curious about reporting in the upcoming grant year. I know there is a lot of questions for, at least for the MSPI, DVPI, around referral tracking. And so I could review that. I know for ACORNS, they definitely have a lot of components around, I know community, what is it right now? Yeah. So I'll just give you the space to ask the questions, but I'm happy to give any guidance.
And if you want to type your questions in as well, feel free to do that. Our information's on here. Again, we'll be sending out this recording to everybody who attended and people who we have on our listserv that said they were going to attend and maybe weren't here. But we'll post it on, the ACORNS will post this through their website and their channel. So I know Geneva, Cherry, Sahib, if you're familiar with them, on ACORNS will be posting this again if those of you that aren't here for this live want to rewatch it. But we would definitely want to make sure our info is here. We're going to be doing follow-up webinars if that's going to be something of interest for both our grantee groups. But we definitely want to know if there's more advanced topics that want to be covered. We can definitely go into, again, Excel, for example. There are many ways. Some of you, the ACORN grantees that I work with, we do this same exact thing, creating the database and doing like pretty advanced analysis for them, cross tabulations, frequency reporting, things like that for their grants. And then, or sometimes they'll report to council. So if you need that kind of assistance or you would like that kind of webinar, more on the presentation of the analyses and our findings, or even report writing, those are things we can help with as a tribal epicenter. But yeah, they require some feedback if you would like. But we'll wait around for another couple minutes for people who want to have questions and stick around and talk with us. But yeah, if there's no questions, those of you that are on, feel free to go ahead and exit if you want. And those of you who want to ask questions, we'll be here for a few more minutes to go ahead and go over examples and stuff.
Okay, well, it sounds like we're good on questions. Again, you have our contact information, and I know that if you have more nuanced needs, that's what we're here for as an epicenter. And feel free to reach out to us via email or phone. And thanks so much for coming along.
Thank you, everybody.